Young athletes strive to stay a step ahead of the competition. Sometimes, this means practicing beyond their growing body's limits, modifying their eating habits, and attempting to play through injuries. Our pediatric-trained physicians and staff specialize in educating athletes on healthy habits, injury management, and the prevention of sports injuries.
Does that bother you at all?
Patients in the sports medicine program reap the advantages of cutting-edge injury prevention technology. Children's uses Dartfish, a motion analysis technology, to detect mechanical flaws in sports motion, which ultimately helps physicians treat pediatric sports injuries.
Like I said, you probably wouldn't be that far off if you stood upright.
The role of the athletic director is to support our athletes, parents, coaches, to provide an overall experience for our kids through their high school years. Last year, we had a student who was injured at a football game, and right away our trainer was on site, assessed the injury. We got the student taken to emergency care at that moment, but the trainer saw that whole process through.
We also offer a pre- and post-concussion testing program using Impact software. If a head injury is suspected, the athlete is referred to the Children's Sports Medicine Concussion Program, where he will receive thorough diagnostic and physical exams, as well as a neuropsychological evaluation, if needed, all of which aid our physicians in determining a safe return to play.
I came to the Children's Sports Medicine Program off a recommendation from my pediatrician. What really stands out to me is that Dr. Marshall took the time to actually visit my school and talk to my teachers about the nature of my injury and how I needed time off to recover. And they wouldn't let me return to sports activity until they knew 100% that I was ready to play. And it really felt like they cared about me.
Children's has a reputation for being a premier children's healthcare in the Southeast, so I felt comfortable here.
Don't let costs get in the way of having a good trainer. In a budgetary time, it's easy to say, I don't need this, I can use student trainers. It's not worth it. Having somebody who's certified, who can still even train your student trainers and make them better, it's worth every penny.
Several athlete education programs have also been created. The Children's ACL Sport Performance Enhancement and Injury Prevention Program is designed to improve speed, strength, and agility while incorporating proper mechanics and muscle recruitment for sports-related activities. Ultimately, through proper training, conditioning, and the instruction of healthy guidelines, the risk of ACL injury will be reduced, all while improving sports performance.
The experience I had here with the staff at Children's was mainly with Dr. Marshall and with his trainer, Dave. We would come here and Dr. Marshall would assess John and talk to him about his symptoms and his feelings, and then Dave would administer the impact. I have seen coaches and trainers that are changing their practices based on the information that he's getting out to the community.
We just felt like after meeting with everybody and us wanting to have a full, comprehensive plan for our athletes, we felt like Children's could give us the best coverage with the best support, and we feel like we have the best trainer of anybody in high school.
In collaboration with the Georgia High School Association's Wrestling Weight Management Program, the Children's Sports Medicine Program tests athletes to ensure they wrestle at a healthy weight. Children's also helps establish a safe weight loss plan the athlete, coach, and parent can follow that will allow the wrestler to attain his or her competitive wrestling weight in a safe manner.
If you want your kids, your players, your athletes to have the best treatment, then you'll consider going with Children's Healthcare.